Okay, the 6 rights of medication administration are right drug, right dose, right person, right time, right route, and right documentation. Today we are medicating Pat Jones. I'm going to hand wash. His date of birth is 1/15/1936. He has a diagnosis of dehydration, confusion, duodenal ulcers, diabetes mellitus, peripheral neuropathy, depression, and COPD. He has no known drug allergies, and he has an 1800 ADA diet. The doctor's orders. We have an insulin flex pen that he gets 3 times a day before meals. We have Docusate sodium, 100 milligrams. We have gabapentin, 600 milligrams. An escitalopram oxalate, 10 milligrams. And omeprazole, 20 milligrams. We also have PRN insulin sliding scale. And then we have a morphine sulfate PRN every 4 hours if he needs that for pain. So I am going to start with the insulin and get that ready. Hand wash again because I can never hand wash too much, I guess. I'm going to set my supplies, give him some water. And a med cup. Okay. Open my cart. Hand wash again. Get my insulin flex pen. Needle. This is for Pat Jones. Expirations within date. This is a subcutaneous injection. Okay, I'm gonna clean and get alcohol wipes out of here. I'm going to clean the top of the flex pen and connect. Open this without touching. Okay, now I'm going to prime it to 2. Prime our needle. Pat Jones has a standing order for 12 units of subcutaneous insulin through his flex pen. He also has a blood sugar right now of 276, so we're going to give him an additional 6 units of sliding scale. So I'm going to give him 18 units total. And there's the 18 units. Have another nurse verify.
Yep.
So this is insulin and an insulin flex pen for Pat Jones as my 3rd check. He gets it 3 times daily before meals. We're going to inject 18 units, including the sliding scale, and it is within expiration. Next, I'm going to get my oral medications. So first, we have a Docusate sodium, 100 milligrams. So here I have a Docusate sodium, 100 milligrams. That is within expiration. I'm going to verify one more time. Docusate sodium, 100 milligrams within expiration. Next, I am going to get gabapentin, 600 milligrams. Our gabapentin tablets come in 300 milligrams, so I'm giving him 2 of these. So 2 gabapentin tablets, 300 milligrams to equal 600 within expiration. I'm going to verify a second time. Gabapentin, 600 milligrams. So I have 2 of those capsules within expiration to take PO, and you'll also take the Docusate sodium PO. Next, we have an escitalopram oxalate, 10 milligrams. So we are going to be getting it out of this fun little thing. We have 1 of these escitalopram oxalate, 10 milligrams within expiration. My second check, we have escitalopram oxalate within expiration, 10 milligrams. Now I'm going to get my omeprazole, 20 milligrams. So I have omeprazole tablets within expiration, 20 milligrams. Okay. And now my third check, I'm going to put them in the med cup. So first we have a Docusate sodium, 100 milligrams, within expiration. Get these all open. Okay. Out of way. Next we have gabapentin. So we have two 300 milligram tablets to equal 600 milligrams. PO within expiration. So there's one. Second one. Next we have the escitalopram oxalate, 10 milligrams within expiration. So we're giving him one capsule of these, PO, if I can get it out of there without, oh nice. And finally we have the omeprazole, 20 milligrams, PO, within expiration. Okay, I have all my oral medications. This morning, Pat reported to his CNA that he had a pain level of 8, so we are giving him as needed morphine sulfate. We're going to give him 6 milligrams because he reported a pain level of 8, and from pain level 6 to 10, you give 6 milligrams. And this will be an IM injection, intramuscular injection. Okay, so I have morphine sulfate, 6 milligrams, and this is 10 milligrams per milliliter. So I have within expiration. Okay. That's my first check. My second check, I have morphine 6 milligrams as needed every 4 hours. IM for pain of 6 to 10. So I'm gonna grab a needle. Okay. Clean the top of my adapter. Alcohol too soon. That's not the right one. That's the right one. And since I just opened this, I don't need to clean it. I already cleaned off my adapter. I'm going to draw up 0.6 milligrams of air. And insert that in. Then I'm going to draw up 6 milligrams. Okay. Here's my 6 milligrams.
Okay.
And I will have another nurse waste the morphine with me. The rest of the morphine in the vial. So now I will, still not touching this to anything, connect to my needle. And as a third verification before we waste this, I have morphine sulfate. We have 6 milligrams that is within expiration. And then we would waste the rest of this. I'm gonna hand wash again since I touched my face. Okay, I think we're ready to give Pat meds. Help. I'm gonna take some alcohol wipes with me. I'm gonna throw away the rest of my stuff. I'm gonna take my little tray, not drop anything, not trip. Okay. Hello, Pat. I'm Kylie. I'm gonna be your student nurse today. I have some pain medication for you and some other good stuff. Can I have your name and date of birth?
Pat Jones, 1/15/36.
Perfect. Pat, do you have any allergies?
Nope.
Okay. Okay. I'm gonna raise your bed some. Well, not throwing any meds off of here. Pat, this morning they told me that you have a pain level of 8. Is that correct?
Yes.
Okay. I'm gonna hand wash again. I'm gonna put gloves on. Okay, so I have some morphine for you. We have 6 milligrams of morphine. And that's gonna go in your left arm because they reported to me yesterday that they gave the injection in your right arm last time.
Yep.
So I'm gonna lift your shirt up a little. I'm gonna palpate about 3 fingers below the acromion process to find the belly of the muscle. Okay. We're gonna clean the area from the outside, inside out. Okay, we'll let that dry. I'm gonna put this bed rail down. Okay. Okay, Pat. So I'm gonna use my fingers, quick poke at 90 degrees. We're gonna go real slow to give you this morphine intramuscularly. Then I'm gonna hold that for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great job. I'm gonna activate the safety needle feature and dispose of this in the sharps container. Okay, Pat, next we are gonna give you some insulin. This morning the CNA reported to me that your blood sugar was 276. So you have your 12 regular units that you're getting as well as 6 additional units for a total of 18. I'm gonna give them in your belly. Does that work?
Yep.
Okay, great. So the nurse that was on last night told me that she gave in the right side, so I'm gonna give it to you on the left. Oh, I'm dropping stuff on the floor. Okay, I'm gonna clean the area about 2 inches away from the umbilicus. Wait for that to dry. We have 18 units in your pen, and this is a subcutaneous injection. Gotta wait for you to dry, sorry, Pat. Okay. Okay, Pat, small poke. We're gonna go slow. Okay, we're gonna hold this for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great job. safety needle. Dispose of it in the sharps container. I would have provided for privacy initially. Okay. Pat, finally we have some oral medications to give you. We have a Docusate sodium, which is for constipation because you are getting heavy-duty pain medication, so that's going to help keep you regular. Next, we have gabapentin, 600 milligrams of that. That's for your peripheral neuropathy. We have the escitalopram oxalate, which is 10 milligrams, which is an antidepressant. And then we have omeprazole, 20 milligrams of that, which is for the ulcers you have. It's an antacid. Can you take these all in one?
Yep.
Okay. Here's some water and your medications. Let you take those. Great. Take a look, make sure you got them all down. Looks great. Okay, Pat. I'm gonna take my gloves off now. I'm gonna provide safety. Put your bed all the way back down. I put you in high Fowler's position to take those medications, so I'm gonna let you sit up for a few minutes. Your breakfast should be here in about 30 minutes, which is why we gave your insulin 30 minutes beforehand. Here is your call light. Do you need anything else right now?
Nope.
Okay, I'm gonna hand wash. Take my stuff with me. Give you your bedside table. Okay. So now we're back at the med cart, which I would have locked and taken the keys with me initially. So I would have done that. I would have taken the keys with me and locked the med cart. So now we're going to unlock the med cart that I locked previously. We're going to return Pat's flex pin to the drawer because it's multi-use. We wouldn't have any leftover medications. And I think that's what we got. I will document in his electronic medical record what time we gave these. I'm going to throw away the rest of my stuff. Throwing that away. Throwing alcohol prep pads away. And now I will document and hand wash again, I guess.